Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very interesting topic, nystagmus. Of the nystagmus series consisting of 3 episodes, today we are going to talk about non-neuropathologic nystagmus. The non-neuropathologic nystagmus, cranial nerves part 40, ocular motor nerves part 26. Nystagmus. But what is nystagmus? Nystagmus is a rhythmic, biphasic, involuntary movement of the eyes. The clinical approach includes deciding if the nystagmus indicates neurologic pathology, if so, whether the pathology is central or peripheral. The common conditions causing nystagmus include ocular disease, drug effects like phenytoin, peripheral vestibular disease, CNS disease, and physiologic nystagmus. Nystagmus is classified as pendular, both phases of equal amplitude and velocity. It rarely signifies a neurologic disease. Jerk, a slow and fast component, a fast and slow component. It is classified by the direction of the fast phase. So nystagmus is classified as pendular or jerk nystagmus. We have an important law for nystagmus which is known as Alexander's law. What is this Alexander's law? Alexander's law, it states that the jerk nystagmus increases with the direction of the fast phase. Alexander law states that the jerk nystagmus increases with the direction of the fast phase. There are 3 degrees of nystagmus: first degree, second degree, and third degree. First degree, example, right beating nystagmus on right gaze. Second degree, right beating nystagmus on primary gaze. Third degree, right beating nystagmus on left gaze. Nystagmus can be classified as non-neuropathologic nystagmus and neuropathologic nystagmus. The non-neuropathologic nystagmus. Nystagmus that does not signify neurologic disease, which may be physiologic or because of ocular disease, example, poor condition or other conditions. Non-neuropathologic nystagmus or physiologic nystagmus. Types of physiologic nystagmus include endpoint, optokinetic nystagmus, and induced or vestibular nystagmus, which goes by the acronym COWS, COWS. Cold, opposite, and warm, same. So if you see here in this diagram, the frontal eye fields area number 8 and the vestibular apparatus both are connected to PPRF. The frontal cortex, the frontal eye fields area number 8, is connected to the PPRF and moves the eyes in the opposite direction in a fast manner. It moves in the direction, and it moves to the opposite direction because the paramedian pontine reticular formation connects the 6th nerve, that is the lateral rectus, on the same side, and the PPRF also connects the MLF on the opposite side, and the MLF connects the 3rd nerve and medial rectus on this side, and therefore when the frontal eye fields is stimulated on one side, the eyes move to the opposite side because of the PPRF stimulation, and it is in a fast manner known as saccadic pathway. We also have vestibular apparatus which also goes and connects the PPRF, but here it pushes the eyes in a slow manner. You can see here it pushes the eye in a slow manner to the opposite direction by connecting the PPRF. So when the vestibular apparatus is stimulated by putting warm water or turning the head to the side of the stimulation, the opposite PPRF is stimulated So the eyes goes to the opposite side. So when the vestibular apparatus is stimulated by turning the head to one side or by pouring warm water, the eyes goes to the opposite side because PPRF is stimulated, and therefore the body tries to correct, and by trying to put it to a normal position by the front eye fields area 8 on this side, trying to put it back to its neutral position. So there's nystagmus. So when the vestibular apparatus on this side is stimulated by pouring warm water or turning the head to the side of the vestibular apparatus, the eyes goes to the opposite side, and this time the front eye fields on this time, which connects to the PPRF on this side, will try to push it back to its neutral position. So there is nystagmus. So this goes by the acronym warm same side. We talk about nystagmus as with the direction of its fast phase. So when you put warm water, eyes goes to the opposite side, but nystagmus is to the same side, that is WS. When you put cold water, opposite things occur, and the nystagmus is on the opposite side. That's why there's an acronym COUS, cold opposite and warm same. So this is non-neuropathologic nystagmus, that is induced vestibular nystagmus, COUS, cold opposite warm same. The other forms of non-neuropathologic nystagmus include drug-induced nystagmus, example phenytoin. Congenital nystagmus, it is most often horizontal. They often have a null point of least nystagmus intensity. Nystagmus damps with convergence. But one important characteristic feature of congenital nystagmus is inversion of optokinetic nystagmus. Inversion of optokinetic nystagmus. A virtually pathognomonic feature moving an optokinetic nystagmus tape so as to cause an unexpected summation with a fast phase of congenital nystagmus produces instead a diminution or a paradoxical reversal nystagmus direction. So inversion of optokinetic nystagmus is a virtually pathognomonic feature of congenital nystagmus. Then the other cause is ocular disease. Patients with poor disease vision may develop a continuous pendular nystagmus. So these are all the important concepts of the non-neuropathologic nystagmus. I hope you have enjoyed listening to these concepts. The other important concepts of neurology, I put it in a question answer format in the book called Focused Neurology, written by me, Dr. Sreenivas. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased from Amazon online. I hope you have enjoyed listening to my concepts. If you have really enjoyed this video, please like, share, but do subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.